Welcome and thank you for joining me today. My name is Corey Ranji, and today I'm going to be presenting my integrated seminar project, a proposal that I've developed called Increasing Access to Mental Health Support for Underserved Youth with School-Based Therapy. This presentation is going to cover the agency background, the purpose and research question guiding my project, the proposed intervention, and how it integrates core social work competencies to address mental health access for students in our community. I am a Master's of Social Work student getting ready to graduate at Park University, and I'm wanting to specialize in clinical social work. And this project specifically focuses on barriers to mental health access for youth and adolescents. The project originated from my experiences at the Samaritan Counseling Center as a clinical social work intern. I was seeing firsthand how many young people struggle to access the mental health services they need. Working with youth and families, I noticed some reoccurring patterns, things like transportation challenges, financial constraints, and then the stigma that often creates significant barriers to care. These challenges were even more pronounced for students who lack consistent support systems or resources outside of school. The focus is on developing a school-based therapy model that brings support directly to students in their educational environment, removing common obstacles and reducing the gap between youth and essential services. So by targeting underserved populations, this project seeks to create a practical and sustainable way to meet students where they are, promoting emotional well-being and academic success simultaneously. At its core, this proposal reflects a commitment to the values of social work service, equality, and empowerment, and demonstrates how thoughtful program design can bridge systemic gaps to better serve vulnerable youth in our community. So now I wanted to talk a little bit about the agency I've been doing my practicum at, the Samaritan Counseling Center. It provides affordable, accessible mental health services to youth, families, and individuals in St. Joseph and the surrounding rural communities, and it has been doing this since 1986. The agency's mission is rooted in providing trauma-informed care and partnering with community organizations to meet the local mental health needs. Through a multidisciplinary approach to mental health, the Samaritan Counseling Center providers promote the physical, emotional, social, and spiritual well-being of all individuals. Our team at the center specializes in the following professional services. We do mental health assessments, diagnosis and treatment, professional counseling, psychological testing and medication management. We have peer support specialists there and a doctor who treats substance use disorder. The Samaritan Counseling Center provides over 8,000 counseling sessions each year, and we're able to do that through funding with a nonprofit, local nonprofit, the United Way of Greater St. Joseph. We get grants, community donors. We do take insurance, so insurance reimbursement is part of that. What I really love about the Samaritan Center, though, is that we don't turn anybody away. So if you don't have insurance, or if you don't think you'd be able to afford care, we have funding that will pay for people to get treatment. We don't send them to collections. Like we want you to be seen if you need to be seen, and we work to do whatever we can to get that done for you. So the purpose of this project is to explore whether implementing a school-based therapy model would significantly increase access to mental health services for underserved youth in our community. As I stated before, many young people face multiple barriers to care, like lack of transportation and financial limitations. They might even have difficulty connecting with providers outside of the school environment, depending on what their life situations are. So, by situating therapy services directly in schools, this proposal helps seek to remove those barriers. The project is grounded in core social work values like the promotion of access to essential services, advocacy for equality in mental health care, and the empowerment of youth and families to build resilience and well being. I think it also emphasizes the role of social workers as agents of systemic change. This is recognizing and addressing the mental health needs of underserved youth requires not only individual intervention, but it also requires collaboration with the schools, families, and the wider community. So ultimately, the purpose of this ISP is not just to create a program, but to lay the foundation down for a sustainable model of care that reflects, the best practices and the heart of social work ethics. So, what is the question I'm asking? My research question is: would providing school based therapy increase access to mental health services for underserved youth in the community? I think this question guides the design of the intervention and the proposed evaluation methods. For this research project, I'll be using a mixed methods design, quantitative and qualitative. Uh, I'd like to use the strengths and difficulties questionnaire at the start and end of a 6 week intervention to measure emotional and behavioral changes. And qualitatively, a semi structured interview process with 3 to 5 stakeholders, such as school counselors, teachers, would be used to understand how feasible this project would be, and get some system level perspective. The surveys would be collected in week 1 and week 7 with a projected sample of hopefully 15 to 20 students. My intervention design is going to be like a 6 week school based therapy program that I would design to provide accessible trauma informed mental health services to the students. The program would consist of weekly 45-minute sessions held within the school environment. I think this just allows students to receive support in a familiar, convenient, and comfortable setting. The therapeutic approach I would use would integrate evidence based practices like cognitive behavioral therapy or CBT to help students identify and change negative thinking patterns. And I would also use motivational interviewing to encourage, self efficiency and just have them be engaged in their own growth. I think these methods are delivered within a strengths based framework. So, really focusing on empowering youth by identifying their inherent resources and resilience. My intervention is grounded within the ecosystems theory. This theory emphasizes that an individual's behavior and well being are shaped not only by their internal experiences, but also by multiple environments they interact with. So, like their families, their peer groups, schools, and communities. This theory shows the importance of addressing both individual and systemic factors, recognizing that change often requires collaboration across all these different levels. By incorporating this theory, the program acknowledges that supporting youth mental health means not only providing individual therapy, but also working within and alongside the school system and community resources to create an environment where the students can thrive. So, although this is a proposal, these are the anticipated outcomes that I see happening. Increased access to mental health services for youth, improved emotional regulation and positive feedback from the students and school stakeholders. I think these results would support research showing that school based models definitely do reduce barriers to care. So, here are the core competencies of social work that I felt align with my project. For competency one, I prioritize ethical and professional behavior by designing an intervention that safeguards dignity and confidentiality. Competency three is addressed through a focus of advancing social and economic justice and by targeting access to barriers. Competency five involves aligning with agency, state, and federal policies for school based mental health delivery. Competency six is demonstrated through stakeholder collaboration, including agency leadership and potential school partners. Seven is integrated by using validated assessments like the SDQ to guide decisions. And competency eight is reflected in the trauma-informed intervention design grounded in the ecosystems theory. So the evaluation plan, I plan to use both formative and summative methods. Formatively, I would track attendance, session engagement, and student feedback during the program. And then collectively, I would analyze the SDQ pre and post scores and code qualitative interviews to assess outcomes and also stakeholder perspectives. And speaking of stakeholders, the stakeholders involved with this project include the Samaritan Counseling Center, the executive director, the board of directors, my field instructor Joyce, and then staff who would help me just assess how feasible everything is and if they have any input. Future phases would involve the St. Joseph School District, the Board of Education, and the St. Joseph School District administrators, counselors, etc. Surrounding agencies, clinics, and mental health care practitioners are vital partners in expanding the access to care and ensuring a coordinated approach to mental health support within the community. So their involvement would allow for resource sharing, referrals, collaborative efforts, and ultimately would benefit the youth we aim to serve. Looking further ahead, the program would plan to expand mental health support by not only serving St. Joseph, but also the surrounding rural area schools, and forming partnerships and collaboration with nearby districts. So it would enhance the effectiveness of the school-based therapy throughout our whole area. And so as far as how I would get the word out, the dissemination plan, if implemented, the results of this project would be shared with the agency's leadership team, the executive director, board of directors, to evaluate the program's alignment with the organization's goals and capacity. The findings would also be presented to the St. Joseph School District, the Board of Education, and school administrators. Obviously, their input and support are going to be crucial to integrate this program into the school environment. So the results would be compiled and summarized into a detailed report for community stakeholders, including potential partner organizations and local funders. This would be designed to support collaboration between schools, mental health providers, and broader community, while also serving as a foundation for seeking grants, networking, and funding opportunities to be able to sustain the program and expand in the future. By sharing these outcomes across these levels, I would hope that would build strong partnerships and create a pathway for longevity. So looking ahead, we need to focus on the next steps, both professional growth and program development. On a personal level, I believe this proposal allows me to build my own skills, not only in program design, but with school-based therapy, working with underserved populations, and just the process of creating this intervention strengthens my ability to translate research and social work values into practical real-life situations and community-based solutions. For the agency, I think this proposal can serve as a blueprint for developing partnerships, again, networking, um, working with local schools and seeking potential funding sources to bring the program to life. These relationships are critical for the sustainability and alignment with community needs. The vision for this project includes like expanding accessible community integrated services, not only in St. Joe, but again, also the surrounding rural areas. By starting with one school district and building a strong model, we can create a scalable program that reaches more youth and continues to break down barriers to mental health care. So, to conclude this presentation, I really do feel like this ISP proposal shows the potential impact that bringing mental health services directly into the school environment can have on underserved youth. We address barriers such as transportation, financial hardship, and stigma. And this school-based therapy really creates a pathway for students to receive the care they need where they already feel safe and supported. I think we summed up that um, this project was rooted in the values of social work, like access, empowerment, reflects a collaborative approach, engages multiple stakeholders, and provides a framework for evidence-based, trauma-informed intervention. While it's currently in the proposal phase, I do think the structure allows for future implementation and hopefully expansion. I know that there are, some community agencies that already are in the school, but why would we not want more resources in our schools, more people that are able to help, the better. So thank you very much for listening. If you have any questions, I would be happy to answer them, but I really appreciate you taking the time to listen about my project. And of course, your feedback and support are invaluable. I am continuing to develop both my skills, um, and I hope this program can better serve students in the future who need it most. Thanks again.